Hello guys, so today we shall be discussing the most trending topic in microbiology, that is your Zika virus, right? So we are mainly concentrating on what? We are mainly concentrating on Zika virus. Now, before I completely talk about this Zika virus, you basically have to know few important things, guys. First of all, what is the nature of this Zika virus? Point number one, discussing about the general properties. Zika virus is a positive sense single stranded RNA. Okay, so what is it? It is a positive sense single stranded RNA, ssRNA, which means single stranded RNA. Now, what do you mean by positive sense RNA? There are two different types of RNA. One is called as a positive sense RNA and the another one is called as the negative sense RNA, right? So what do I mean by negative sense RNA is that negative sense RNA is that this RNA cannot be, all of you know that within the nucleus, right, DNA, whatever message is there on the DNA, that is coded on the mRNA, and mRNA comes out of the nucleus into the cytoplasm, and mRNA will undergo translation to form proteins. You know this thing, right? So mRNA is responsible for the final translation into the proteins, right? So what do you mean by negative stranded RNA? Means this type of RNA cannot directly be transcribed into proteins. Okay, so first of all, negative stranded RNA should be converted to positive stranded mRNA. Positive stranded mRNA, and this positive stranded mRNA can undergo translation. Yeah, this negative stranded mRNA can undergo translation, and as a result of translation you can synthesize the proteins. So this is the story of negative stranded RNA. But whenever it comes to the positive stranded RNA, now this positive stranded RNA can directly be translated to form proteins. So no need of any conversation, right? So previously you have converted negative RNA, negative sense RNA into positive sense RNA, and then you have translated the proteins. But here the positive stranded RNA or a positive sense RNA can directly be translated to form the proteins. So that is a meaning that what I said is the positive sense single stranded RNA. And by the way, this Zika virus belongs to which family, guys? It belongs to Flavivirus. It belongs to a family called as Flavivirus. So these are the most two important things which you need to remember, right? So by the way, what are these called? These both of them are your general properties. Both of these are your general properties. Okay. Now when it comes to the transmission, of this virus, when it comes to the transmission part, can anyone tell how this virus is basically transmitted? Obviously the Zika virus is mainly transmitted through a mosquito, and that mosquito is called as Aedes mosquito. What is that mosquito, guys? That is called as Aedes mosquito. So it is mainly transmitted through point number one, Aedes mosquito, right? Point number two is that even this disease, right, this virus is mainly transmitted through sexual transmission also, right? It is transmitted sexually. It is also transmitted vertically. Vertically means from the mother to the baby, right? From the mother to the developing fetus inside. So this is called as vertical transmission, and sexual transmission you know very well. So there are two types of transmissions. One is through Aedes mosquito, another one is either by vertical transmission or sexually transmitted, right? So which group of people are more commonly affected with this? Those group of people who live in the endemic areas. So these group of people are at higher risk factors. Okay, so there are two routes of transmission which I have already spoken about. One is your Aedes mosquito and another one is vertical or sexual transmission. Now, what is the pathogenesis? Okay, fine. So there is Aedes mosquito here. Now this is directly landing upon my skin and biting my skin inside, right? Now when this mosquito bites me, what it is gonna do, right? What will it do to the skin? What it will do, whether it is gonna enter into my blood or how it is gonna divide and everything, we shall be discussing right now. So these cells which you can see here, guys, these cells are called as, first of all, this is a epidermal layer. This entire unit, this entire thickness of cells which you have drawn, this is epidermis. And all these cells which you can see here, these are called as keratinocytes, right? So all these cells here are called as keratinocytes. So this is your epidermis, and yes, what is the important thing I told you? I told you that these cells are named as keratinocytes. So what is a good thing that you can tell about keratinocytes? 90% of your epidermis is having keratinocytes. That acts as a barrier actually, okay? So this is your epidermis. Now just below your epidermis, guys, you have got dermis. Now within the dermis, you have got some specialized cells. Now what are these specialized cells? Look here. You see the specialized cells here, right? So these cells, I hope by looking at the structure, you might have known the name of these cells. Yes, these cells are called as your fibroblast cells. So I've just drawn two of them, right? And below that, you have got your blood vessels. Obviously, epidermis is not having any kind of blood supply. Rather, the dermis is having the blood supply. So this is your blood vessel. Clear? This is your blood vessel. Now here, one very important thing I would like to mention here is, let me differentiate all these layers, and you know very well that you have these blood vessels, and these are the blood vessels that are supplying up like this. Okay. Now, so what is this layer over here? This is called as your epidermis. Okay. So this entire thickness over here, this is called as your epidermis. And after that, this entire thickness over here, you call this layer as dermis. You call this layer as dermis. Now look here, what is going to happen? What is going to happen is that whenever a mosquito lands on your skin, okay, so I'm not good at drawing a mosquito, but anyways, you see, this is a mosquito, for example, right? So it has got it wide legs, and there is one very important part in the mosquito. This is called as proboscis. So when a mosquito lands on your skin, I mean the Aedes mosquito, so it lands on your skin. When it bites your skin, obviously through that proboscis, what is happening is the viral particles are right now very easily entering into your epidermis. So when the viral particles are entering into your epidermis, look here, let me represent these viral particles in this way, right? So these are the viral particles. So where are the viral particles right now, guys? Viral particles are right now within your keratinocytes. Okay. So what it is gonna do, what these viral particles gonna do in the keratinocytes? What it will do is that, look here, let me explain you a single keratinocyte. Let us say this is a single keratinocyte. Okay, this is a single keratinocyte. And you have got your virus particle here. This is your virus particle. Okay, the Zika virus. I already told you these virus particles are, this Zika virus is nothing but a positive sense single stranded RNA. So obviously within this, you have got a single stranded mRNA like this. Now the single stranded mRNA directly translates to form proteins. So obviously it is, the single stranded mRNA is undergoing translation, and as a result of translation, many minute viral particles are produced, right? Many minute viral particles are produced. So can I tell that the Zika virus replicates within these keratinocytes? Yes, Zika virus undergoes replication within the keratinocytes, and obviously as a result of replication, these virus particles gonna damage your entire cell structure. It is gonna damage the nucleus, it is gonna damage all the cell organelles, and finally the cell will undergo cell death, that is apoptosis. So what is happening with the keratinocytes, guys? These keratinocytes are undergoing what? Apoptosis. So this is the story of the keratinocytes over here, right? So let us discuss what is happening further. So these virus particles, through the proboscis, they enter into the keratinocytes, and after entering into the keratinocytes, the virus will undergo replication. I'm gonna write down all the things, right? I'm just explaining with the picture here. So as it enters there, it is gonna replicate, and it replicates, and finally it is gonna damage the entire cell structure, and finally will make the cell to undergo apoptosis. So what is happening here is there is extensive damage to the cell, apoptosis of the cell. So there is apoptosis of what? All these keratinocytes. So all the keratinocytes here are dead now. Not only that, the particles which have been replicated, they come down into the dermis layer. So these virus particles, which are many in number like this, right? So they descend down into the dermis. And the moment they descend down into the dermis, obviously these virus particles also enter into your fibroblast cells. You see, virus particles are also within your fibroblast cells. And what are these virus particles doing in your fibroblast cells, guys? These virus particles in the fibroblast cells perform the same thing. They undergo replication, damage the fibroblast cells. So even here, there is absolute no surprise here that even the fibroblast cells are also gonna die. There is even death of the fibroblast cells, right? So even fibroblast cells undergo apoptosis. So there is even death of the fibroblast cells. Not only that, the virus, as I told you, it is replicating inside the fibroblast cells as well. So what are the two types of cells that are affected in case of Zika virus initially, guys? That is keratinocytes as well as the fibroblast cells. Okay, so keratinocytes and fibroblast cells. So from here the virus particles start entering into your bloodstream. Virus particles, they start entering into your bloodstream. Now once these virus particles start entering into your bloodstream, so what is going to happen is that, let us say, this is the blood vessel supplying, different parts of your body. Anyways, anatomically it is not right, but I just have to show it to you to understand the concept. Okay, so let us say, let me continue this blood vessel, guys. Let me continue this blood vessel all the way down like this. So let us say the first preference which we gonna give is to a beautiful joint. So let us say this is your joint capsule which I'm drawing right now. Right, so this is your joint capsule over here, and within this joint capsule, what things you would find, guys? You would find a lot of hyaluronic acid, synovial fluid and all, right? So this is a joint. So obviously what is happening here is that these virus particles, right? So these virus particles are going all the way like this, they ascend all the way, right? And these virus particles, they gonna enter into the joint, and once they enter into the joint, virus particles will not damage the joint. But what is happening? What is happening is that virus particles, they go sleep on the joints, right? They rest on the joints. So looking at the virus particles, your innate immune response, right? Your immune system activates, and this immune system will go towards the joint, wake it up and start killing them. So there is a fight between your immune system and these virus particles. And where is this fight happening? The fight is happening on the joint. So obviously patient will have damage to the joint. And this kind of damage to the joint, this kind of damage and inflammation to the joint, you call it as arthralgia. Patient will have joint pain also, right? So arthralgia. So point number one, what is patient going to have, guys? Arthralgia. Second very important thing, that let us say this is a blood vessel that is supplying the fetus, the developing fetus, right? So let me draw a picture of that. This is the mother. This is the mother where there is developing fetus inside. So this is the baby that is developing inside, right? This is the baby that is developing inside. Clear? Now, one very important thing you need to know is that between the mother and between the baby inside the developing fetus, you have got a barrier, right? So this is the, let us say my right hand indicates the developing fetus and this is the mother. So blood vessels from the baby, blood vessels from the mother, both of them they join together and form so-called placental barrier, right? So I cannot show you the placental barrier here, but just a rough picture of that. Just think that this is your placental barrier like this. Okay, so this is your placental barrier. Let us say this is your placental barrier. Okay, so what is this? Let me write it down. Placental barrier. Right. So what is happening here? What is happening is, even the virus is so small, the virus size is so small that this virus, even through the blood supply, it even enters into the placental, it even crosses the placental barrier and enters into the developing fetus. Now when it enters into the developing fetus, the first most important thing which all of you might have expected is miscarriage, right? So this virus is so small that it is going to cross the placental barrier, guys. So this virus will cross the placental barrier. Okay. So once this virus crosses the placental barrier, what is going to happen? What is going to happen is that it is going to damage the amniotic layer and the chorionic layer that is surrounding the developing fetus, right? So the baby going to end up having amniochorionitis, inflammation of amnion and chorion layer. So as a result of amniochorionitis, there will be what? There will be miscarriage. There will be miscarriage. So the first thing is the placental barrier part, second thing is the amniochorionitis, and the final thing is you're going to end up having miscarriage. Not only that, not only miscarriage is just point number 1. Not only miscarriage, point number 2, what is going to happen is really shocking. Point number 2 is that it is going to affect the baby in such a way that after the birth, you see the baby's head is too small. There is microcephaly. So this condition is called as congenital microcephaly. Congenital microcephaly or cephaly. Congenital microcephaly. Not only congenital microcephaly, guys, I'm going to show you those pictures of congenital microcephaly and miscarriage and all of that. Not only that, another important thing that can happen is that this virus can enter. Okay, so this virus can enter into the brain. You see, you look at the picture here. So you see the virus, right? See, this virus is entering inside, crossing the placental barrier, entering inside, and from there it is entering inside the brain of the baby. So when it enters inside the brain cavity, this virus causes some calcifications within the brain. So when I look at a CT scan, right, when I look at a CT scan, I will find minute calcifications in the brain, right? So these are called as intracranial calcifications. What are these called? They are called intracranial calcifications. Intracranial calcifications. Not only that, guys, obviously every part of the baby will be involved, so even the eyes will be involved because they're so sensitive. You'll also find intraocular lesions. What is that intraocular lesion which I'll find? There are many of them. Just remember intraocular lesions. That is enough for your exams, intraocular lesions. So what it is gonna happen? What it will happen is that first thing miscarriage, second thing congenital microcephaly, third thing intracranial calcifications, and fourth is intraocular lesions. So these are the four very important things which you will find in a neonate, right, in a developing fetus that is affected with the Zika virus. Clear? Another important thing is that let me close up this blood vessel. The first affection started in the skin, right? So the first important thing which you need to look here is that the keratinocytes in the epidermis are gone, the fibroblast cells in the dermis are also gone, right? They have undergone apoptosis. So don't you think when you look at the skin of the patient, won't there be any kind of discoloration, right? So can I call it as a skin rash, right? And these skin rashes will be pruritic. In 20% of the cases, these skin rashes are pruritic. So patient will also have a pruritic skin rash. And obviously, headaches are most common. Headaches are most common. So these are the most important things which you would find in a patient who is suffering from the infections that are caused by Zika virus. So what investigations can I do, guys? What are the investigations? So what are the investigations can I order? Regarding the investigations which I order, right, regarding the investigations which I order, the first important investigation which I would like to say is that this is an acute infection. In acute infection, what antibodies will rise in your body? Obviously IgM, right? So if you check the urine of the patient or the serum, right? So serum or the urine are the two best sources where you can find IgM antibody. So you will find IgM antibody, right? And mostly the pregnant women who are living in the endemic areas or who are exposed to these mosquito bites most frequently, they are at a higher risk of getting Zika virus because you know the risk factors, you know the ways of transmission, right? So they are at a higher rate, right? They are at a higher risk of getting this Zika virus infection. So especially in those pregnant women, you need to do this IgM test. Okay, so when do you do this IgM test? You do it in the first and the third trimester. So you do this IgM test in the first, in case of pregnant women. You do it in the first and third trimester. Apart from that, if the test is positive, let us say if the test is positive, the second test you have to do, that is a confirmatory test, and that confirmatory test is called as your RT-PCR. Okay, what is RT-PCR? Reverse transcriptase polymerase chain reaction. So this is the second test which you do, right? So this is the confirmatory test, the gold standard test. So if you find IgM positive, then you do the RT-PCR test. Okay, so these are the investigations which you basically do. And regarding the treatment, guys, there is no specific treatment for this Zika virus. All you need to do is that the symptoms will resolve automatically, but all you need to do is that patient is having headaches, so you need to give pain medications, because patient is also having arthralgia, right? Patient is having joint pains, patient is having headache, so you need to give pain medications. Patient will definitely have fever when there is virus in your body, so you need to give antipyretic medications. And most commonly, any kind of infection in your body, you tend to lose water. Keep that thing in mind. So that is the reason why any kind of infection, guys, any kind of bacterial, viral, fungal, any kind of infection, if you are affected, definitely you will be dehydrated. That is the thing. The first thing you do when you get admitted in the hospital is that run fluids for the patient. That is the normal saline, right? So these are the three important things: normal saline for hydration, pain medications for arthralgia and headaches, for fever you give antipyretics. So this is called as a conservative or the supportive treatment. When it comes to the complications, guys, What are the complications which I would like to find? What are the important complications I would find in my patient? What are the important complications I would find in my patient is that all of you know this thing, that let us say this is your neuron. Okay, so let us say that this is your neuron over here, right? And these are the dendrites over here, right? And all of you know very well, surrounding the neuron you have got myelin covering. So who synthesized that myelin? Myelin sheath, right? That myelination is synthesized by special type of cells, and these cells are called as Schwann cells. These cells are called as Schwann cells. And what are these Schwann cells doing? Schwann cells are synthesizing the lipid around it. Myelin is nothing but your lipid. In this way, right? Now, what is the important thing I would like to discuss? What is the important thing I would like to discuss is that these patients who are affected with Zika virus, the damage of the neurons is so severe that there will be complete demyelination of the neurons. So all the myelin is lost. So when all the myelin is lost, how does the picture look, guys? All the myelin is lost. So this is a demyelinated neuron, right? So what is this neuron? This neuron is a demyelinated neuron. So when there is demyelination of these neurons like this, right, from the bottom to the top. So neurons from the bottom, right, below, neurons from the bottom, they start getting demyelinated, and this demyelination ascends up like this. So obviously, as there is demyelination, there will be paralysis. For example, the neurons in my hand, if they are demyelinated, then what will happen? The impulse conduction will be very weak, very slow. So it will take a lot of time for my hand to get up, right? If I want to raise my hand, it would take a lot of time. Or I can say I cannot raise my hand at some times. So there is paralysis, right? In these patients, the paralysis starts from the bottom because demyelination starts from the bottom, from the legs, and it ascends upwards. So can I call it as ascending paralysis or ascending demyelination? Yes. So the disease which I am talking right now, because of the Zika virus affection leading to demyelination of the neurons from the bottom to the top, leading to ascending paralysis, this is called as Guillain-Barré syndrome, GBS syndrome. Okay. So the most important complication that one can have here is Guillain-Barré syndrome. Okay, Guillain-Barré syndrome. Right. So let me recap all of these things which you just have to remember for your exams, nothing more than this, guys. So all of you know that most common transmitter, all of you know that this flavivirus, so this flavivirus is most commonly transmitted. Most commonly transmitted by what? It is most commonly transmitted by ADs. So this is point number 1 which you need to remember. Point number 2. Point number 2 is that in case of adults, what will be the symptoms? In case of adults, the symptoms will be conjunctivitis. Not only conjunctivitis, there will be low grade fever and itchiness. Not only conjunctivitis, there will be low grade fever. Third important thing is itchy rash or skin rash with pruritus, right? Itchy rash. Clear? So this is the second important box which you need to remember. Okay. Apart from this, in case of embryo, the developing fetus, right? So what will be the things which I can expect? The first important thing is, as I already told you, it will be, yes, congenital microcephaly. congenital microcephaly. Apart from this, there will also will be intracranial calcifications. Intracranial calcifications and as well as ocular lesions. That is not that important, but these two are very important, which you have to know. Clear? So these are the three important boxes which you remember, which you have to remember at the end of the day anyways. So these are most important boxes for your exam point of view, right? And what they can ask basically is what type of antibody which you see, that is IgM antibody, right? Apart from that, what type of cells are affected? There are two types of cells that are affected. One is called as keratinocytes and the other group of cells are called as your fibroblast cells. So these green color cells are fibroblast cells. And you know that patient will have arthralgia, patient will have miscarriage and all of these things which you have already discussed.